Hi, this video is for users of best practice software, BP Premier, and will demonstrate how to add Aboriginal and Torres Strait Islander status to patient records. In BP Premier, this is referred to as ethnicity. Ethnicity status can be added or changed at any time in BP Premier, but it is good practice to ensure it is entered whenever a new patient is registered. You may wish to include this information on your new patient registration form. And please note there are best practice guidelines for the best wording to use when asking this question. The recommended wording is, are you of Aboriginal or Torres Strait Islander origin? More information about guidelines can be found in the link at the end of this presentation. To record ethnicity status in BP Premier, access the View Details screen of the patient details. You can do this in many ways, of course. However, I will demonstrate from the main screen by clicking on the filing cabinet icon, then entering the first few letters of the patient's surname, ensuring I have the correct patient, of course, and selecting View Details. Select the drop-down box next to ethnicity and then click to select as your patient has identified. When you click on the drop-down arrow, you will note there are 6 options. These options are Australian, non-Indigenous, Aboriginal but not Torres Strait Islander, Torres Strait Islander but not Aboriginal, both Aboriginal and Torres Strait Islander, other, not provided. I am selecting both Aboriginal and Torres Strait Islander in this example. Click Save to save these changes. You'll note that I accessed the View Details screen from the Open Patient screen. You can access View Details from within many areas within BP Premier. For clinicians, you may already have the patient record open. You would simply double click in the demographic area on their phone number, perhaps, and you will access the View Details screen and can update as the patient identifies. And save. This video has demonstrated adding ethnicity within BP Premier. Accurately recording Aboriginal and/or Torres Strait Islander status by selecting from the list is important for many reasons. Firstly, some guidelines for screening and management are different for clients of Aboriginal or Torres Strait Islander origin. Having status recorded allows service providers to ensure that all patients have an opportunity to access relevant services specifically designed to meet their needs. Secondly, when you select from a coded list within BP Premier, there is additional functionality that depends on this information. For example, if you select Aboriginal and/or Torres Strait Islander status, you will be prompted for relevant health checks or screening. Recording status correctly ensures that data extracted from your system for reporting, quality or research purposes gives an accurate account of the Aboriginal and Torres Strait Islander population you provide services to and the health issues they face.